key message that I want people to know is that if you are in trouble, there is a place to turn. There's a place for hope. Our whole vision is really about people not having to suffer through a crisis alone, that we are there 24/7. We care. We have volunteers who are here because they care. And no matter what the situation, no matter what the loss, I know recently with the death of Robin Williams, it's made people more aware of issues around suicide. So if that's the issue, for example, and I think this was one of the big pieces too, because it's also Suicide Prevention Awareness Month during Memphis Crisis Center Awareness Week, is to let people know that when they're hopeless, there is a place to turn for hope. And one of the things that we're all about is about building hope in people. Now, I realize people can't just exist on hope alone. And so the other piece of what we do as part of that crisis intervention process with folks is we do work to link them to the resources in the community that can help sustain them in the long term. So, it's both of those things. And as long as people know that, hey, there is a place that I can turn, there are people that are there because they care, and there are people that are willing to help me in this situation. That's the main message I want people to get out of Memphis Crisis Center Awareness Week. Now, secondarily, I am hoping that those who have a passionate heart, a caring ear, those who want to help, will also step in. I know that we are volunteer powered on our hotlines, and so we really rely on volunteers to provide the services that we provide. And so I'm hoping also that the secondary piece of Memphis Crisis Center Awareness Week is to make people aware of ways that they can help, whether that is making a financial gift or making a gift of time. We always need volunteers. We always need people to be engaged. A big piece of what we do is not just promoting community stability through the intervention we do on the phones, but also engaging the community in many ways in its own safety by bringing the community in to actually provide the service. So both of those pieces, I think, are pretty central to what we do. And of course, the last piece along with that is raising community awareness, making people aware that this service is out there. If people are unable to access a service because they don't know about it, then it doesn't matter if the service is there. So people need to know that we're there and we care 24/7. And no matter what the problem, no matter what the loss, no matter whether it's a mental health issue that you're dealing with, whether it is grieving, whether it is drugs and alcohol, whatever the situation is, your life is at least worth a phone call. And I always try to emphasize that to folks.